My Lords, the noble Lord, the Lord Balcathra, and I have grave concerns on the present single-sex ward provision, which our two amendments seek to obviate. I had the opportunity already to discuss this with the Minister himself, the noble Lord Kamal, and I am grateful for the opportunity that you gave me also to meet with your officials. Nonetheless, these two amendments address the very sensitive issue of hospital bed space allocation and hospital service provision for women. Traditionally, female patients in the NHS and in private hospitals have been allocated beds in single-sex wards accommodating only women patients. Transgenderism, and I speak as a woman, has undermined that provision with the 2019 NHS guidance authorising self-selection of patient gender on arrival in hospitals, something neither enshrined in law nor backed by public demand, and overriding the exemption for hospital services on the 2010 Equalities Act. Yet Parliament and our ministers have consistently declared that women both need and should have privacy, dignity and safety in their most vulnerable of situations, such as when sick or pregnant. And as consistently, ministers on all sides of both houses have declared that this will be or already is the case. In 1999, for example, when serving in the other place, the then Health Minister, the noble Lord Hutton of Furness, responded to powerfully expressed concerns from the member of North East Forest East about female privacy by guaranteeing single-sex wards and enshrining that promise in the Patients' Charter. Later, when the NHS Constitution replaced the Patients' Charter, the same firm commitments were made. And today's nurses, whose code of practice ensures that all patients have their privacy respected and dignity and safety assured, should have a simpler task in ensuring that these truly fundamental responsibilities to all patients are fulfilled, since the old Nightingale wards, in which sex segregation was much needed, really do not exist in the present NHS hospitals, where there is a mixture of single rooms or 4 to 6 bedded bays. It is therefore easier for ward sisters to keep the sexes apart rather than mix sex bays which give rise to discomfort for female and male patients alike. Nonetheless, female patients consistently find that the reality of mixed-sex wards has run through against the Aesculapian tradition of prioritising patient care on medical grounds alone. We now find the earlier guarantees of safety, dignity and privacy of women are blown apart up and down the country by hospital trusts who are mandated to follow Annex B of the NHS 2019 guidance on self-sex accommodation. I find too many errors and wrong quotations of the Equalities Act to feel comfortable with this guidance in its Annex B. While the guidance demands same-sex wards for 11 pages, saying providers of NHS-funded care are expected to have a zero-tolerance approach to mixed-sex accommodation, it then contradicts itself on page 12 with trans people should be accommodated according to their presentation, the way they dress and the name and pronouns they currently use. These two requirements are not only incompatible, they are irreconcilable, nor do they follow the 2010 Equalities Act. A staff nurse told me that her NHS trust policy makes it impossible for her to do her job. She is obliged to advocate for the vulnerable, but trans rights supersede all other rights and concerns, and if she speaks out, she is challenged. A cervical smear of a 14-year-old where the mother requested female nurse could not be done. The child left because, in fact, it was very clearly a natal male who came forward to offer the service. Nurses tell me they feel very inhibited in doing their jobs and are afraid to speak out for fear of being called bigots or disciplined through loss of jobs, and I've met several nurses who've lost their jobs because of this. Surely human rights are about the dignity of each person. They are not the privilege of the few to the detriment of the many. A doctor says he no longer feels able to make comments about sex and gender. He recently delivered a baby. He said it was a girl, and he was accused of transphobia. In fact, hospital services are excluded from the Act, and in any event, mixed-sex bathing and toileting facilities are precluded both by the Nursing Code and by the NHS Constitution Handbook, as are mixed-sex wards except under exceptional medical need and at the patient's request. However, that same premise is discarded. If a male patient self-declares as a woman, he then has access to all the female toileting facilities, for example. I turn to patient safety. On respiratory care ward recently, a male patient got into the bed of a female patient. The woman was so distressed, she refused to wear the necessary breathing apparatus in case it stopped her being able to escape a similar situation. And on a mixed-sex ward, a male nurse, now serving a prison sentence for the offence, raped violently a female patient. It is axiomatic that in any hospital setting, patients are at their most vulnerable, and that NHS medical professionals take great care to avoid any extraneous stress. It is therefore puzzling as to why the NHS had chosen to prioritise mixed-sex wards or bays, assigning bays in female spaces, as a matter of right for patients who are in the general transition process when the physical and the psychological diverge, or who may have completed transition but nonetheless can never recover their prepubertal underdeveloped strengths. It is surely obvious that prostate cancer patients remain male, and that loss of breasts in women cancer patients does not remove their womanhood. Of course, there are voices which claim that sex is assigned at birth. In fact, it's noted and recorded, and that sex can be changed through a mix of operations and continuous hormonal drugs. I do not hear the NHS making that claim. And since in our society we follow the science, here in our House the noble Lord Winston has made that very clear indeed, we must conclude that so far the NHS cannot change a patient's sex. My argument rests on that assumption. In common with traditional practices which affect all faiths, ethnic backgrounds and historic behaviour patterns, our amendments request a restoration of earlier female patient safety, privacy and dignity, the core purpose of single-sex wards or bays. I conclude the NHS has taken a wrong turning on this issue, since its own policy is to provide same-sex accommodation, and since Parliament chose to make hospitals exempt from the service provisions of the Equalities Act, a decision which has not, to the best of my understanding, been reversed in either House of Parliament. It is my contention that this policy profoundly disadvantages women in the entire NHS hospital setting. Of course, the gender bias adopted by the NHS reflects mainly males in women's setting. And recently, the Equality and Human Rights Commission has announced that they will be publishing very soon, I believe, a paper on this issue, and we wait for that. The EHA, their current guidance discusses service provision and reminds us that male transgender present patients are not deprived of hospital service provision, just that they should not be placed with women. They can easily be placed away from male wards which may disturb them, side rooms, so that all have equal access to services and all be treated with dignity, privacy and safety. Non-placement on women's wards does not in any way undermine this. They also reiterate balance of rights and the need to ask patients their preferences. This does underline the need for a review, to have women's voices and a full equality assessment. Of course, we must ensure all voices are heard, and for that purpose I have now set up a working group of trans persons to clarify what rights are they that they see as missing or underfunded. I hope to present the results to the noble Lord the Minister to add to his department's body of knowledge. I end by saying that language is very important. As a parent wrote to me today, it is only since becoming the mother of a disabled child that I realised quite how nefarious the wrong body narrative is, which is another part of this argument. If someone can be born wrong, that implies there are inherently right and wrong types of people. History has surely taught us that this line of thinking never ends in a happy place. Like you, to myself, I believe that all children, whatever their circumstances, are born perfect and deserve to be treated with respect and love. And at the core of human rights, which must be the foundation stone of her argument, is the concept of human dignity. Bodily integrity is closely related to dignity and autonomy, and has been described by Hale L.J. in her judgment as the most important of civil rights, and as the first and most important of the interests protected by the law of tort. Bodily integrity is protected by Articles 3, freedom from torture and inhuman or degrading treatment, and by Article 8, respect for private life of the European Human Rights Convention. Other groups, women, persons with disability, enjoy special protection. Language matters, it leads to human action, and whether that be good or bad for us comes from the language in which our views are expressed. Humiliation, separation, degradation of others all stem from the language used to describe a group or an individual. Cis woman is as unacceptable as wrong body. Both are degrading of the individual. The National Health Service is magnificent. I speak as its former global special envoy, but not necessarily can it always be perfect. I urge the noble Lord the Minister to set up a review of language and actions used to sustain the safety, dignity and privacy of all patients, especially in this context, women. I beg to move.
After clause 148, insert the new clause as printed on the marshalled list. My Lords, Baroness Brinton is participating remotely, and I invite her to speak now.
My Lords, I wish to speak against the two amendments, 297F and 297G, moved just now by Lady Nicholson. One incident last week explains why these two amendments are dangerous and unnecessary. Last week, a woman on Twitter, who I won't name, who was in hospital, said the following: "This is incredibly hard to say, and I couldn't feel more foolish, embarrassed, awkward and dumbfounded as I do now. But it's been confirmed that the person I believe to be male on the hospital all-female bay I was on was, in fact, a female. This has been 100% verified." She went on, "I have no words other than how on earth did I mistake a woman for a man? Delicately and with respect, I say she was a very emasculated woman, and I'm just totally stunned right now at the mistake, my mistake, and am mortified that I took to Twitter, utterly convinced that the woman who looked and sounded like a male turns out to be quite genuinely a female. I apologise for causing a storm and will take some time off Twitter while I let it sink in. I cannot understand how I got it so wrong. I feel a complete idiot." End quote. The problem, my Lords, is that these two amendments feed into the conspiracy movement against trans people and preys on vulnerable women like this who believe there is a problem. The fear inculcated by the gender-critical movement means she felt entitled to aggressively call out a complete stranger minding her own business in her own hospital bed in case she was a trans woman. Yet, my Lords, the reality is that there is absolutely no evidence whatsoever of trans people causing problems on single-sex wards. And all Lady Nicholson's examples of assault were by men, not by trans women. And what's more, trans people, just like people who are not trans, have a right to privacy and dignity in hospital, just like everyone. Imagine if the patient who had been aggressively called out by this woman had been a trans woman. Is that the sort of behaviour of someone ill in hospital in any way appropriate? Of course not. The First Amendment, 297F, in the name of Lord Blencathra, sets out how to record instances where people complain about trans people simply on the basis that they're trans. Now, such behaviour may be part of a pattern of behaviour which may result in risks to any patient who is trans or visibly gender non-conforming, or, as in this case, a woman. Not allowing or recording of such incidents may then take place the NHS Trust at risk of failure in their duty of care if something should subsequently happen between the two parties. Lady Nicholson started to outline the definition of harassment under the Equality Act, which is violating a person's dignity or creating an intimidating, hostile, degrading, humiliating or offensive environment. The amendment would only restrict recording of incidents involving trans people, but not other gender non-conforming people. As such, it would be a discrimination, as trans people would be prevented from having discriminatory actions against them recorded, while everyone else would not be so prevented. The Second Amendment flies in the face of current hospital practice. The NHS already has policies relating to where trans people should be housed, which makes reference to the types of treatment required and the requirement for respecting privacy and the dignity of the trans person, alongside the privacy and dignity of all other patients too. This amendment would overrule those policies and therefore override the privacy and dignity of trans patients. It would clearly breach basic human rights legislation. And, by the way, trans people may require medical treatment for conditions relating to their lived-in sex. Trans women may get breast cancer, for example. Requiring them to be housed in different accommodation could mean that the specialist nursing care required for their recovery may not be available. But there might also be an unintended consequence of this amendment too. If trans people know that they will be housed with the people of their birth sex rather than their lived and legal sex, many will avoid going to hospital altogether, leading to many having increased and dangerous health complications. And this could be potentially life-threatening, which is implicit discrimination under the Equality Act. As the recent incident highlighted on Twitter show, there actually isn't a real problem to be solved, and all these amendments do is to seek to demean and ostracise trans women in our society. I do hope the Minister will not support them.
My Lords, I speak in support in particular of 297G. This will give much-needed statutory force to what has been long stated NHS policy, but which is not always being properly implemented, and which is where I will demonstrate the current guidance is equivocal upon. I am not, I hasten to add, a conspirator against trans people. I make that absolutely plain, and I resent the suggestion that those speaking in support of this amendment might be thought to be. My Lords, the current NHS guidance, which goes back historically a long way, as we've heard, is in these terms. All providers of NHS-funded care are expected to prioritise the safety, privacy and dignity of all patients. We all agree with that. Adherence to this guidance is an essential part of this. It then goes on to talk about mixed accommodation. What is a mixed-sex accommodation breach? Patients should not normally have to share sleeping accommodation with members of the opposite sex. Patients should not have to share toilet or bathroom facilities with members of the opposite sex. Patients should not have to walk through an area occupied by patients of the opposite sex to reach toilets or bathrooms. This excludes corridors. That is what hospitals should be doing, but I ask you all to note in particular the terminology. Note the use of the terms mixed sex and opposite sex. Sex, we all know, is physiological. It dates for conception. It is not something assigned at birth or at some later date. Sections 11 and 212 of the Equality Act, the definitions of man and woman, refer to sex, not gender. Further, Part 7 of the Schedule 3 of the Equality Act provides at paragraph 27 that a person does not contravene Section 29 of the Equality Act by providing a service only to persons of one sex if that service is provided at a place which is or is part of a hospital, or if the circumstances are such that a person of one sex might reasonably object to the presence of the opposite sex. So hospitals are free to do what they wish and to prioritise single-sex wards. But in contradiction of the law, physiology, and the primary guidance to which I've referred above, Annex B of the guidance provides, and I can't read it all out because we haven't got time, transgender is a broad inclusive term referring to anyone whose personal experience of gender extends beyond the typical experience of their assigned sex at birth. So we're moving from sex to gender, and it is premised on a scientific flaw. Building on that error, it continues, if patients are transferred to a ward, this should also be in accordance with their continuous gender presentation unless the patient requests otherwise. So it's not there saying they should be put somewhere safe or separate. They should go to the ward which they wish. And if they say a women's ward, they go to a woman's ward. That is not what Secretaries of State, what has been policy for 20 years, and it departs from the primary guidance, and it is, I submit, and I'm sure you will all agree, something which is wrong. It discriminates against women who don't wish to be in the presence of someone who is an intact male, as some trans people will be. So there we are, Clause 297G, the amendment there is one which is perfectly reasonable, it is absolutely right, and I urge the noble lords to adopt it.
My Lord, I rise to support the amendments in the name of my noble friend the Baroness Nicholson of Winterbourne and myself, and I pay tribute to her for raising this issue of vital importance to women and for being their champion over many years in the face of some bitter attacks from a minority of some trans zealots. And I must say to the noble Baroness Brinton, I resent the implication that somehow we're attacking trans people by these amendments. There is no conspiracy against them. We want equal treatment for everyone in the NHS. And if there's any conspiracy, it seems to be to demean the status of women. And I also say to the noble Baroness that, yes, if these amendments were accepted, NHS policy would have to change. NHS policy would have to change to comply with the law of the land, the Equalities Act 2010, because it is in breach of the exemptions in that Act at the moment. Now, my Lords, as we all know, there's no real privacy in hospitals, however hard they may try. If one ties that funny gown the wrong way, like a dressing gown, then one's front is exposed. If one ties it properly, then the rear is exposed. Even when one is recovering and wearing pyjamas or female attire, bed attire, it's impossible in a hospital to carry out the routine of getting into and out of bed and using the washing and other facilities without some part of one's anatomy being exposed. Many patients neglect to close or lock washroom doors, and some with mental health problems may express sexual disinhibition. And of course, when doctors come round and pull the screens round, there's still the discussion of one's condition and the medical profession's obsession with bowel movements, as we all know about. Now, my lords, I'm old enough and ugly enough not to care what medical professionals see what parts of my body. They've all poked and prodded and cut out various bits of it over the years, so I'm reasonably immune to embarrassment with them. However, I would find it highly embarrassing if I found a woman or a man declaring as a woman in the next bed and encountered her in the ablutions. Of course, it's highly unlikely that I would meet a woman, since there are an infinitesimally small number of women identifying as men, but many more men identifying as women. All my life, my lords, there has been an NHS policy of single-sex wards, and governments of all colours have been slammed on those occasions when men and women were sharing hospital accommodation. The policy is that patients should not have to share sleeping accommodation, nor toilet nor bathroom facilities with members of the opposite sex. My word, the operative word is sex. Biological sex, not gender. And since we're speaking about women and sex and hospitals, can I put some astonishing medical information on the public record, which has resulted in some women being sacked or abused for saying it, and I stand to be corrected by medical experts present. My lords, I believe that only women can give birth to children, since only women have wombs. No matter what one declares one's gender to be, only men get prostate and testicular cancer. Only women can breastfeed their children, and men who have chests cannot. The sex of babies is not assigned at birth. Babies are born as boys or girls, and that includes those born with those rare congenital disorders of sexual development. So no one decides to assign male or female to a baby. They're born that way. And so that is why the term sex assigned at birth is so offensive. Now, of course, my lords, in the course of daily life, working in most jobs, going to the pub, etc., sex and gender don't matter, and one can call oneself what one likes. But when it comes to medical treatment, there are two vital factors which can determine the diagnosis and the treatment, and these factors are age and sex. Sex is the only thing which matters medically, not gender, and that has always been the case until the mistaken guidance issued in December 2019. The NHS always recognised that single-sex accommodation was not only essential for a patient's privacy and dignity, but also for their treatment and recovery. Doctors recognise that patients in distress, for whatever reason, cannot recover as easily as those who are comfortable in their surroundings and who are not fearful of people of the opposite sex seeing their bodies at a time when they're at their most vulnerable. That is why the NHS guidance stated in absolutely unambiguous terms, quote, "There are no exceptions from the need to provide high standards of privacy and dignity at all times," unquote. As my noble friends have pointed out, it all went haywire in the Annex B of the guidance, which failed to implement the Equality Act of 2010 and said that trans people should be accommodated according to their self-identification, which the guidance say, quote, "may not always accord with the physical sex appearance of the chest or genitalia," unquote. It also goes on to say, the pre-operative trans people should not share open shower facilities. Well, my lords, I'm sure that Jewish or Muslim women find that immensely reassuring, that can be in a shower with a man so long as he had some operation on his genitalia. Now, this is the advice I've had, my lords, from an expert, a Jewish expert in medical ethics. It says, the religious requirements of Orthodox Judaism mandate single-sex facilities both for men and for women, where people are likely to be in a state of even partial undress. This includes the requirement for single-sex hospital wards, bathrooms and changing rooms. The distress, both psychological and spiritual, that is likely to be caused to Orthodox Jews if they're forced to share facilities with members of the opposite sex is considerable, as is the impact on the patient's family. Orthodox Jews are, of course, protected under the Equality Act on the basis of their religious belief. It would be wholly unacceptable were an Orthodox Jewish woman to be counselled by NHS staff into accepting the presence in the bed next to hers of a male patient who identifies as transgender. My lords, that's the advice I've received on Orthodox Judaism. I assume that the requirements of Islam are similar. I don't know, I assume they are. But my lords, these needs of women should apply to all women, whether religious or atheist or pagan, and not just those with particular religious beliefs. What is so wrong with NHS Guidance Annex B is that the Equalities Act of 2010 specifically exempts hospitals and the provision of joint services where a joint service for persons of both sexes will be less effective and where there are circumstances where a person of one sex might reasonably object to a person of the opposite sex. So I say to my noble friend the Minister, the law is clear. Women have the right to be kept in hospital accommodation only with other women. Of course, one exempts intensive care units where patients are unconscious or nearly unconscious, and their medical treatment is best served by all being in the same specialist unit together. So I call on my noble friend, the Minister, to withdraw this flawed guidance on transgender patients and instruct the NHS to comply with the law of the land. Now, a brief word on Amendment 297F. I've read reports that some NHS trusts have logged women as transphobic when all they've done is request single-sex accommodation and not to be in a bed next to a man identified as a woman. There are a few reports of this. It's nothing to do with anyone on Twitter sending a rant about some hateful person next to them. It's ordinary women saying, please, can I be in a room where I don't have men next to me? It's as simple as that. And they are being recorded, I am told, as being transphobic for merely making that request. Now, I asked my noble friend in a written question what evidence he has of this, and he said, unfortunately, or fortunately, centrally, the NHS does not collect this information. It's only left to the trust. I accept that, of course, but what I want my noble friend to do is issue an instruction to all NHS trusts that it is perfectly legal for a woman to make this simple request, and she must not be stigmatised as transphobic for asking. Now, that's completely separate, my lords, and quite different from anyone who makes racist, offensive or threatening or genuinely hateful transphobic remarks. Now, of course, there must be absolutely no discrimination against trans people in hospital or discrimination against anybody. Our amendment makes it clear that trans people must receive equal medical treatment but that does not mean that their gender identity wish must be accommodated over and above the wishes of people of the opposite sex. My Lords, if there were a finely balanced conflict of rights here, then I would take the view that the rights of those demanding that their gender identity should take precedence over women's sex is wrong, and that the rights of women should prevail. But there is no fine balance here. The NHS, in my opinion, is breaking the Equalities Act of 2010, and I request that they obey it as soon as possible.
My Lords, I just want to make a brief intervention. I mean, I want to ask the Minister. The contention is that there is a tension between the NHS England guidance on single-sex wards, which is eminently sensible, and then Annex B. And I'd be grateful if the Minister could actually respond specifically to that. In particular, he will know that Schedule 3, which the Noble Lord has referred to in the Equality Act in relation to single-sex services, is permissible. So it's permissible for the NHS to provide separate accommodation for women who are biological females. But my reading of Annex B is that really seems to exclude that option. And again, I'd ask the Minister what the government's view is on this. My main reason for intervening is simply to say to the Minister, surely there is a case now for a government review of the guidance. In particular, he will know that the Equalities and Human Rights Commission are very shortly going to update their guidance on single-sex services. And clearly, my Lords, it would be very sensible to review the NHS guidance in the light of that. And I think an assurance that this will happen would be very appropriate.
My Lords, I want to support the Noble Lord Hunt in his very reasonable request, it seems to me, to get the Minister to confirm that a review will take place. My Lords, I remember some 20 years ago I was challenging the Noble Lord Hunt when he was Health Minister. The pledge for single-sex wards had been made by his predecessor, I think it was Lady Jay, and it was a very slow road towards single-sex wards, my Lords. And then reading Annex B, it seems that suddenly we're in a completely different place, my Lords. The goalposts have been moved, and I don't quite understand who was consulted about Annex B, and where we go from here in the face of completely different wording in the main guidance to the actual annex itself. How can one reconcile this, if you like, gender-friendly Annex B with a single-sex ward pledge in the main guidance, my Lords? At the very least, there needs to be a review about what exactly is the regime that we want to support. And I entirely agree with those speakers who say I don't believe that anybody who raises this issue should be labelled in one way or another, my Lords. I was particularly concerned, however, I must say, to see that effectively if you classify yourself as non-binary, you can take your choice as to whether you go in a ward of any particular sex. Now, my Lords, I don't know that I see that in any equalities legislation or human rights legislation in particular. And that seems to me to be the hardest point, and I can't understand quite why that has appeared. So, my Lords, I don't think any purpose is served by lurid examples of this, that and the other. As a lawyer, I know that hard cases make bad law, my Lords, but at the very least, I believe the conflict between the main guidance and Annex B does really need to be resolved in one way or another, my Lords, absolutely clearly, probably with parliamentary approval. It's got to be conforming to equalities legislation, my Lords, and I very much hope the Minister will pledge to take that forward.
I always enjoy listening to Lord Blencathra because he has quite an absolutist way of delivering his ideas. But I think his ideas here have prompted other noble lords to a very sensible suggestion that we need to look further at this. If I could just make one point. I do think we have to look at this question with great compassion. Compassion for women who feel uncomfortable, but compassion for women who actually are trans. And I say this because we all know that people are born sometimes with mixed chromosomes. It's not black and white. It's a very complex issue. So I think the suggestion of the noble Lord Hunt of King's Heath, and I see Lord Blencathra nodding, I think that must be the right way forward. It needs to be looked at with great care and in great detail, and by people who know what they're talking about.
My Lords, I very much agree with the noble Lord Hunt and others. I was here for 20 years during the struggle for single-sex wards. It was a notable achievement of the benches opposite that they got there. I remember in those long debates getting a real understanding of the distress that women felt from being made to suffer in mixed-sex wards. I don't think it is right to destroy all that just in the cause of a small group of patients. I think the rights of women need to be considered alongside those of trans people. Both matter, both are important, and we should not, as Stonewall has sought to do, bend the law to impossible interpretations and impose that covertly on the National Health Service. We should try openly to discuss this difficult issue and arrive at a compassionate solution that does our very best for all patients. And I have faith that if the Minister promises that, we will get that.
I think that the noble Lord Hunt used a very important word. He used the word contention. A contention that there is a tension between the rights of women and rights of trans women. He and I disagree about that because I believe that they both deserve to be treated properly and respectfully. And I do believe that the Equalities Act enables that to happen. It's the Equalities Act that enables there to be single-sex provision. It is precisely because there are occasions and times when it is important for that to happen that we had to embody that in law. Otherwise, they wouldn't exist. And it is why, under the Equalities Act, there is a specific statement that there should be safeguards in place, and that there are special circumstances where treatment needs to be sex-specific and necessitates a trans person being put in an otherwise gendered ward. Such departures are allowed, but they need to be proportionate to achieving a legitimate aim. And like the noble Baroness Brinton, I don't believe that making assumptions about a person because of the way they look is a legitimate aim. I've listened very carefully to all of the speeches that have been made, and they have contained some very powerful contentions and assertions. What they have not contained is any evidence at all that this is a significant problem in the NHS. I think that these amendments would cause a significant problem in the NHS, and actually I think they would cause a problem for all patients, not just trans patients, if one thinks through the implications of what's been written in them. I think that NHS staff routinely, day to day, have to deal with patients of all sorts, with all sorts of difficult problems. And as professionals, they make judgments day in, day out about what is appropriate care. And unless and until there is significant evidence that backs up the assertions and the contentions of Baroness Nicholson and Lord Blencathra, I believe that we should leave them with the guidance which has worked perfectly well up till now.
My Lord, sir, I intend to be brief because we don't believe that these two amendments are either necessary or appropriate in the context of the Health and Care Bill. If the Equality and Human Rights Commission are conducting a wider review into single-sex services, then we should consider those issues at that time, but not in the context of this bill. And I agree with the noble lady Baroness Brinton that the Equality Act 2010 and the NHS guidance delivering same-sex accommodation 2019 already provide an effective mechanism for inclusion in the context of single-sex wards. These two amendments seek to cut across long-standing provisions in both those pieces of regulation, the Equality Act and the NHS guidance on delivering same-sex accommodation. And my Lords, there is no substantial evidence to suggest that the status quo is not working and that NHS professionals are unable to use the existing guidance, which clearly sets out the principles and practice to be followed. My Lords, we also consider the amendments could do harm if they were to be implemented because they would create a blanket rule requiring trans women to be treated on men's wards and trans men to be treated on women's wards. At best, this would create an environment that is contrary to the dignity and well-being of the patients. At worst, it would leave trans patients at risk of harm and abuse by outing them in a public context at a time when they are particularly vulnerable. My Lords, like other noble lords, we've received the detailed briefing from Stonewall, imploring us to oppose these amendments, and given that we don't consider this bill is the right place for consideration of these issues, we will not be lending our support to the amendments.
My Lords, I am grateful to my noble friend Lord Blencathra for bringing this discussion before the committee today, and to my noble friend Baroness Nicholson for her time in meeting about this issue, on which she is a strong advocate. This clearly is an issue that arouses strong feelings, but I think it's really important that we remember two principles here: dignity and respect. And what I mean by dignity and respect is there are people who feel that they were born in the wrong body and we should respect their rights as trans men or trans women. At the same time, there will be some women in wards who see someone who to them seems like a man, and they may feel slightly vulnerable at a particularly vulnerable time when they're in hospital. It's right that we get the right balance. Noble Lords will be aware, or I hope they will be aware, that the NHS England is currently reviewing the delivering single-sex accommodation guidance to ensure that it remains focused on privacy, safety and dignity for all patients. The NHS is committed to meeting its duties under the Equality Act, and as such needs to give due regard to both those whose gender identity is the same as their biological sex at birth, as well as those who are not. This means that the rights and needs of women and trans women are equal in law. Reviewing the guidance, the new content of the guidance will be informed by engagement with a wide range of stakeholders and by the NHS statutory duties outlined in the Equality Act 2010, including the public sector equality duty. NHS England is currently undertaking this review and is fully aware of the importance, and the guidance, updated if appropriate, is due to be published later this year. I would call on noble lords not to preempt the outcome of this guidance review, because any guidance will and indeed must be compatible with the requirements and duties placed on the NHS bodies by the Equality Act 2010. I am aware of concerns that have been raised about the safety of women in single-sex wards, but we as a government believe that violence of any kind has no place in NHS facilities, and we expect hospital staff will act in the best interest of all patients and can, if necessary, call upon security staff and law enforcement to ensure everyone is safe. I will repeat my request to my noble friend Baroness Nicholson for evidence of such cases, whether it be women who feel uncomfortable, or patients or staff who have raised concerns and have been accused of being transphobic. If that is the case, I would ask the noble Baroness to bring these cases to my attention, and we can look at them further. But given the fact that the NHS England is currently reviewing the guidance, I hope the noble lord can appreciate the need to allow them time to review the guidance in full, and I ask the noble lord to withdraw his amendments.
I thank the noble Lord the Minister very much for his immensely helpful statement, while reminding him that the rights of another group does not supersede the rights of the group that is already there. In other words, there is no simple comment really worth listening to that says, well, women and trans women are equal. We are all equal in the law. We all have dignity. We all have equal rights. My contention is that the dignity, the privacy and the safety of women patients, which has been fought over for several decades in both houses, is now being diminished significantly, and their health undermined, their recovery from illness significantly undermined by the imposition of new rights of others on top of women's rights. And it amuses me that nobody is suggesting they should be on top of men's rights. This, I'm afraid, is a matter of great concern to all women, and I know that members of other benches have demanded evidence and so on. Well, I can't guarantee that within 24 hours, if you wish it, I can get 20 to 30 or 40,000 letters in front of the Minister claiming women need privacy, safety and dignity, and that they are not receiving it with these new impositions. So if you want to have the evidence, feel free. I would add that I deliberately did not raise the case that Baroness Brinton has seen fit to raise, the noble Baroness Brinton, of the lady on Twitter. I know her. She has many problems. I know exactly who she is, her name and where she lives. She's invited me to visit her. I probably will. And I know that she has problems, and therefore I persuaded her to get off Twitter and not to put herself to any more distress. She's very poorly, and I don't think that was a really fair person to bring up. So I thank the noble lord immensely, and from my point, I fully accept his offer that we will be having this review, but I would ask that we are all involved in this review, because I know that women have not been involved in the earlier discussions that produced this extraordinary Annex B.
The noble lady seeking to withdraw
the amendment.
Right. Is it your lordship's pleasure that the amendment be withdrawn? It is by leave withdrawn. Amendment 297G, Baroness Nicholson, not moved.